Hi there, I'm Brian Fitzsimmons. I'm an obstetrician gynecologist, medical director of the care program at BC Women's Hospital. So the hormonal methods of contraception mostly work by inhibiting ovulation. So if the medication prevents ovulation from happening, then a woman is not going to be fertile because there's no fertile egg that can be penetrated by a sperm and thereby create a pregnancy. And the most important hormone in contraceptions that contain hormones that prevents ovulation is progesterone. Most common forms of contraception on the market containing hormones are combined estrogen and progesterone. And the reason why estrogen was added was to decrease the side effect of breakthrough bleeding, because progesterone on its own can cause bleeding. So estrogen was added to decrease the amount of bleeding that occurs. Unfortunately, there are side effects with estrogen, and over the years, the estrogen dosage has changed quite a bit to try and decrease the risk of side effects, but still decrease the risk of breakthrough bleeding. So essentially, for hormonal contraception, it's the progesterone that's important to prevent ovulation. The other bonus side effect of progesterone is that it can thicken the cervical mucus and decrease the lining of the uterus, so it can make the periods lighter and it can decrease transmission of STI, but that's a really small benefit. Copper IUD, a lot of people think that the copper IUD causes abortions. It actually doesn't. What it does is it creates an inflammatory reaction or a hostile environment in the uterus for the sperm and the egg to meet. So it prevents actually fertilization, and it can prevent implantation of an egg. So it doesn't cause an abortion. It just prevents pregnancy just by causing inflammation. And the copper in the copper IUD prevents the sperm from actually penetrating the egg itself. So it has a number of ways of working. The Mirena IUD and the Jadis IUD, which contain levonorgestrel, which is a type of progesterone, that works by blocking the opening to the uterus by thickening cervical mucus, and it also thins the uterine lining so that implantation can't occur.